provide more market forces, keep it out of the, we don't need another bureaucracy. I mean, I'm a firm believer that government does few things very well. In fact, let me think about that. Is there anything that they do extremely? I don't think so.
Military.
Military, but that's a different issue. So.
Ed, you're the money guy, and you're saying that you think this is going to cost $50 million, give or take.
That, no. This will be
that's what you said.
No, that's what I think. That's what they've told me so far, and I haven't seen the details on that. But if it costs substantially more than $50 million, it's going to have to be. Hopefully, this program is scalable so that we can sort of not so much sneak up on it, but phase it in over a period of time, depending on what the total cost of the program.
Well, my question is this: in Missouri, which this is at least somewhat similar to, was at least 5 times that cost.
Right.
How does, help me, I'm not good at math, how do we go from something that's similar to a few months ago was 5 times that cost to doing it for only $50 million now?
Well, it's because of, the way this program is structured. I mean, it's voluntary input, and the people involved have to participate in it. There's going to be co-pays in terms of insurance or whatever, and what we're trying to do is to get a pool of money, that's the $50 million, that we can use as incentive packages, as incentives to get people to opt into these programs.
One of the things about Insure Missouri that a lot of legislators didn't like was kind of they were taken by surprise. Were House and Senate members, especially on the Republican side, were they heavily consulted for this, or was it mainly the groups, as you said?
No, I thought there was a lot of input from legislators, both on the House and the Senate side. But I think the difference here is that Kenny is very willing to work with the legislative branch, because that's absolutely important to get any of these programs through. And in a real sense, Insure Missouri was a little heavy-handed with respect to that, and there was some pushback. But I think this is a plan that's still, that you want to say, a work in progress. And there'll be a lot of little changes made as we go through and try to fine-tune it. But it's going to be it has to be a legislative process. It can't be something that a governor comes up and says, this is what I want to do, and you guys do it.
So assuming your re-election, is this something you would be sponsoring then next year?
I'll be heavily involved in it, that's for sure.
Where's the money going to come from as far as that $50 million? I mean,
well, $50 million is a workable number. $250 million is not. Let's just put it that way.
Your expertise really hasn't been healthcare. It's been more of the budget. Is this something that you think you can, be heavily involved in?
All of economics deals with issues like insurance, why you have insurance, why you don't have insurance. But there are people in the legislature who have a lot more background in this than I do. So, if I'm involved in the technical standpoint, at any technical standpoint, that's fine.
So were Urban and Shaw consulted as part of the development of this?
Yes.
They like it?
I don't know. I didn't get a chance to ask them.
Okay.
So they were just part of the input team.
Are there certain insurance companies you'll be working with in this plan?
Not that I'm going to be working with, no. We're going to open it up to all the insurance companies, all the health providers.
Kenny mentioned how this is kind of new and it's different than what we've seen. Is it important to kind of have something new for, I guess, people out there to see? Maybe they're interested in trying something?